some of them have a very dodgy track record of paying millions of dollars of fines in the US, for instance, for bad behaviour. They don't even bother to go to court to contest these charges. They just pay up because they're going to make another $1 million just down the road.
The government continues to push us to the American model of healthcare, which is the most expensive and unfair system. The FBI is investigating NHS private provider HCA, Health Corporation of America, after a nurse blew the whistle. Investigations show 50% of heart operations performed by HCA in Florida were unnecessary. Patient notes had been faked to justify the carrying out of the procedures and billing for them. According to Donald Berwick, the ex-head of Medicare and Medicaid in the US, in 2011, the estimated cost of fraud in the US was between $82 billion and $272 billion. It's upwards of 10% of the total spend. Hidden behind the NHS logo, these companies expand.
The vectors for this are the large management consultants like McKinsey, like PwC. They actually make it happen. They move around the world giving advice, and they are the vectors of the neoliberal ideology of marketisation and commercialisation.
All of these marketisation reforms was introduced on the premise of greater efficiency. That, of course, the age-old argument that the public sector is some leviathan bureaucracy which is encased in red tape and that it needs to be reformed to become cost-effective. The reality is that the internal market itself alone, mainly through increased numbers of administrative and managerial staff, led to about a 10% rise in the NHS's budget, which by today's terms is around £10 billion per year.
£10 billion. Pre-Thatcher, the administration costs for the NHS were 5%. Post-Blairite, the administration costs were 14%. And the likely percentage by the end of all these proposed changes is over 30%.
You make profits by cutting back on costs. Costs are staff, costs are people, patients who cost a lot of money. And so what they're already doing is downgrading staff and turning away patients who are expensive. You know, what they want to deal with is a one-off episode in somebody who's basically fit, will get better and go away. They don't want patients with comorbidities, they don't want emergency services, you know, they're basically there to make money, and the money they make will be out of us.
I think you've got to see this as having been a very long-term project, and this is happening at all sorts of different levels. You've got the transatlantic flow from the civil servants and the Department of Health and the MPs and the ministers who go to the US and they are brainwashed. And then you've also got trade negotiations going on at the level of the WTO, the World Trade Organization, but also even in the EU, where in exchange for one set of say deals on agriculture, then countries will voluntarily liberalise and open up their services.
Does it make you angry?
Completely, yes, very angry, because it's something I believe most people who work within the NHS really value. It's a very civilising society. It treats people independent of their ability to pay, and you largely get the treatment you need.
The government now is pursuing two strategies: a strategy of downsizing, closing down all the public services that we, the people, own and that belong to us. They're just closing that down, and at the same time they're transferring what remains to the private corporate sectors.
And then we have TTIP. Alongside this wholesale carve-up of the NHS, secret negotiations are taking place over a new so-called trade deal, which will give foreign companies the right to sue the UK government if denied the opportunity for all comers to bid on the carve-up of the NHS. The government would be unable to block this. It would be out of their hands. It's all about removing regulations so companies can profit, and of course it also removes protection for those working for the NHS. And it will put corporate power on a par with government.
These are absolutely worrying times because the NHS is on the verge of extinction. It's very much imperiled. Vested interests behind this have effectively sold this dummy, sold this lemon to the public. They've played a blinder. They've really managed to conceal the hidden agenda extremely well.
What happens under choice is that providers can pick and choose, not patients, who all want services closer to home.